Hello, my name is Mohammed Bashir Al Darwish. I'm one of the junior doctors from Southampton General Hospital. I'm going to present today one of the projects that we've worked on in the Medicine and Elderly Care Department in the hospital. Our audit, which goes by the title of RCP, staff adherence to RCP guidelines in lying standing blood pressure measurement. A bit of a background. Orthostatic, as we all know, of course, orthostatic hypotension is one of the most significant causes of falls in the elderly care population specifically. So it's important to detect these falls as much as possible, as accurate as possible. The Royal College of Physicians have done multiple surveys online and have found that clinicians have routinely done these measurements, but they found a lot of variations in the way these measurements are done. So they have released a guidance on how to do these measurements to improve their accuracy. So our aim in this audit is to improve the practice of lying standing blood pressure measurement and introduce the RCP guidelines to the staff who were unaware of it. So as we can see here, this is a brief overview of the guidance that was published by the RCP on how to accurately measure the lying standing blood pressure and what a positive result criteria is. So we use this as our guidance to see if the staff were aware of these guidelines and were they performing the procedure in a correct way. So our objectives in this audit were to survey the practice of lying standing blood pressure by the clinical staff in the elderly care ward, and to introduce the RCP guidelines and to show the most accurate method of measuring lying standing blood pressure. And our ultimate goal, of course, was to improve the accuracy of this procedure. Now, the standards we were going against was the standards set by the RCP again. So we were aiming for 100% of staff that should be aware of the guidelines. They measured the lying standing blood pressure according to the guidelines, and they knew how and when to document the positive result. The way we did this was we surveyed the clinical staff working in the elderly care ward. We distributed a questionnaire that had the questions that we wanted to ask about this, and then after that was the first cycle, and then after the first cycle, we distributed the posters of the RCP guidelines. We conducted some more brief teaching sessions about the procedure, and then we re-audited again to see how our intervention improved the results. As we can see here, this is the poster that we used and we distributed around the wards. This is our data collection sheet, and these are the questions that were in the questionnaire. So the first question was, how do you perform the procedure? And we need to document if the staff were doing it accurately according to the standards or not. What information do the staff document? Where do they document it? Have they received any formal training? And are they aware of the existence of the RCP guidance about this? So the analysis was about the percentage of the people who were performing the procedure according to the standard or not. So as we can see here in the first cycle, we had around 20% of people who were performing, only 20% of staff that we audited were performing the lying standing blood pressure measurement according to the RCP guideline. Only 25% have documented, and only 15% had formal training according to the RCP guidelines, and only 10% of staff were able to accurately interpret a positive result. Now, after our second cycle, we can see that a significant improvement in these results. So the percentage of people who were doing it in the correct way have went up from 20 to 65%. And even though we were aiming for 100%, that still counts as a big improvement. The percentage of people who documented and knew where to document and what to document went up from 25% to 85% of the staff interviewed, and all staff became aware of the RCP guidelines, and of course still none of them had formal training because it was short time to actually arrange any sort of formal training. So our conclusion is that staff education have significantly improved the long-standing blood pressure documentation, procedure, and interpretation between clinical staff, specifically nurses and healthcare assistants. They are now more aware on when to inform the medical team that there's a postural drop. They are more aware of what to document, where to document, and most importantly, they have been doing it in the correct way according to the guideline. So we are aiming to re-audit this in the future. Our recommendation for the future future cycles, is to extend it to other wards, not just the elderly care wards, to permanently put up posters of the RCP guidelines in all the wards that these measurements are usually done most commonly in, and of course to explore with the management on providing official formal training on as per the RCP guidelines. The references are the RCP guidelines, which can be found on the RCP London website, and thank you for listening.